it's going to work.
Okay. I can see.
Greetings, everyone. Welcome to our final exam tips session, streaming live on Facebook. I hope you can see and hear me clearly. Just setting up at my end here. And if you can see and hear me, I'm just setting up my comment box. So just type in a hello if you can see me now and if you can hear me clearly. Okay, hello everyone, I'm back. I can see a few people have joined us for this session, so that's wonderful. Hello to some people I know. Hello to Catherine. Hello to Barvik. Hello Rajesh. Shala, welcome. Glad you can see and hear. And glad you could come along to this session today. All right, now I'm multitasking here and making sure that my Facebook is working well. I'm just double checking something. Is that streaming for you? Because with me on Facebook, it's like it's paused on Facebook.
Oh, no, it's streaming for me.
Okay, wonderful.
Maybe refresh your page.
All right. Nearly ready to go. Just refreshing my page. Okay. I'll just type in a little welcome. And just before we begin, yes, Mary's typed in. Could you all just say, those people here for the live session, just say what your profession is and where you're located, so I can make sure our comment box is working. Let me just check this.
I'm not too sure why your video, but as long as you're getting the comments, that's okay.
Okay, looks like it's all working. I'm working a little bit with technology here, everyone, but it's great if you can see and hear me and comments are coming in. So Charlotte's Medicine in Adelaide. Well, look, I think we start the show. So we are doing final exam tips, and how many people are doing the exam on December 2? Type in yes if you're doing it December 2. Rita's a pharmacist in Sydney. Yep. So Bhavik is yes. Rajesh, no. Got a longer term plan. Great. Rita is doing the exam. Great. Dr. Sumir is here. Yes. All right. So quite a few people doing the exam. Charlotte's not decided yet, considering possibly January. All right. Well, this session will certainly give you a few good tips and strategies, certainly if your exam's coming up very soon, but also if your exam is in January. Sumaira is here. Sumaira is going for December. Okay, well, I'm going to bring up a new screen now, and you're going to see me disappear a little bit into the corner. And I'll just bring that up, and then I've got one more thing to do. All right, I think you can all see now it's our final exam tip page. I might just shorten that size a little bit so you can see the screen and we can see what's coming up, and that way I can see your comments. Now, one more thing I'm going to do before I continue. I'm just going to refresh my Facebook page. All right, that's working for me now. And I can see your comments. Okay, let's get started. So exam coming up on December 2, and we're going to look at this in the order that the exam is. And so the exam goes listening, reading, writing, and listening, reading, writing, and then speaking. As I go through this session, please feel free to add in your comments, and I'll try to respond to those as well as we go. So listening, everyone. So the new listening 2.0, it's been going for a few months now, has 3 parts, as I'm sure you're all aware. An important thing to remember in this exam is that it's graded. So the part A is the easiest part of the exam, part B is a little bit harder, and then part C is the hardest of the whole test. So it gradually gets harder. What does that mean for you people taking the exam? Well, it means you need to do quite well in part A because it is the easiest part. So you do need a high score in part A. How are you going to get that high score? Well, it's part A, as I'm sure everyone knows, it's 2 dialogues. It's a health professional talking to a patient. As you listen, you must take notes. Now, very importantly, you're given 30 seconds to read those, to read the answer, to read the question paper. So you read it through very carefully, underlining important words as you go, either side of the gap. So you're mentally preparing yourself. You're activating your mind. You're engaging with the text so that you are ready for the answers when they come. Now, it also means you're going to have to multitask, because one of the difficulties that you will face is you'll be taking notes, but while you're taking notes, you must also be listening and following the thread of the conversation. So that's the challenge. And the best way to help with that multitasking aspect, that the listening and writing, is to have prepared well and to have anticipated the answers. So that's the key word there, anticipate. If you can anticipate that the answer is coming and hear it when it comes, it will make it easier to write down and then listen for subsequent answers. Now, the other tip I will say is the majority of the gaps that you fill will come from the patient's mouth, not the health professional. You have to listen to the health professional to see what their questions are, but nearly all of the answers, above 80%, will come from the patient. So you must focus very carefully on that. And the same in the dialogue. It's patient-led in a sense. 80% of the communication will also come from the patient. So they're testing your ability to understand patient language. Is that clear, everyone? Any questions about part A? I think you want to be aiming for at least 9 out of 12. 9 out of 12 would be a good score. So that's what you're really looking for. Okay. Any questions, just type them in as we go. Now, part B and part C are both multiple choice questions. So we'll look at each one individually. So in part B, you've got about 15 seconds before the audio starts. And you've got to use that time effectively. So there's 6 individual questions, each about an audio about 1 minute long. It could be just one person talking, like a monologue giving information about a procedure or a guideline, or it could be 2 health professionals talking and discussing some workplace issue or concern, or it could be a short dialogue between a health professional and a patient. What do you need to do? Well, there's 3 answer choices, A, B, and C, and you need to listen carefully. Read the question so you know what the question is asking. Is it a main idea question or a purpose, or is it looking for some type of detail? About 70% of the questions will probably be a main idea or purpose type question. Probably 30% will be a particular detail. So again, like any multiple choice question, you've got to activate your mind and engage with the text. So the better you understand the question and the answer choices, the easier it will be to make the selection. And as you listen, you should be able to rule out incorrect answers and then make your selection. But you should always be prepared to go a little bit deeper. And a good strategy for multiple choice questions is perhaps what would seem to be an obvious choice is not actually the answer. It's something a little bit deeper. So that's where you need that engagement with the question, because one of the most common errors we see is people just go for like a first impression type answer without thinking deeply enough, and then quite often that's wrong. Now for part C, quite challenging. You've got 6 questions, again 3 multiple choice answers, and it's a 5-minute lecture on a medical topic. It could be a lecture, could be an interview, but it'll be on a medical topic of interest to health professionals. Perhaps some new findings of a new treatment or procedure, or a particular area of medicine, maybe rural, community service, things like that, something topical. The 90 seconds you have to prepare is crucial. So you really got to use that time to go through each answer choice. You'll have your pen in hand and you'll underline the keywords and answer choices. And you should be actively thinking at this stage what the possible answers are, and try to anticipate. Sometimes you may be able to actually predict what you think the answer is. I'll just adjust something here at my end. Couple of other things to be aware of. There's two strategies for Part C, everyone. One of them is to really just focus and listen and try to get that main idea. And that'll really help you for a lot of questions. You just listen and wait, and often you'll hear a word like however or but or some other signal word, maybe due to this reason, or there'll be some signal word, and after that the answer will come. So you really got to wait and follow the thread and then try to grab that answer. But yes, a nice little strategy is to often after contrast words, something important is coming. So pay attention to that. Along the way, you'll be able to rule out certain answers. And of course, remember the answer choices will very often be written in different words to the text. So this thing of just waiting for a keyword is not really effective. You've got to wait for synonyms, but the answer choices will tend to be main ideas. Now, some people may feel listening Part C is challenging, and it is until you get used to it. Once you get used to it, suddenly it becomes a bit easier. You get used to identifying when something important is going to come and to make the right choice. All right. Now, can everyone still hear and see me clearly? And also, any questions about listening, anything I haven't addressed that you're interested in, please type in your comment now, and then we'll move on to reading. So any final comments about listening? And if you don't have any comments, just type in all good. Just waiting for those comments to come through. A few comments have come through now, so let's just have a look here. Most people are saying all good. A couple of people asked, and I'll just have a look here. Just bear with me, guys. Now, so just a sec. Most people are saying all good. A couple of people asked. I've got it. And I'll just have a look here. Yeah, I did. But I don't have the comments again. Just looking for your comments, everyone.
I think you need to get out of that. Go back to the page. There we go.
And comments?
Yeah.
Click this.
Yeah.
Now I'm seeing a few comments here. Just going to do some, just pause for 1 sec. Stay with me, everyone, while we do something here. I'm just going to turn off my audio for a sec. New technology for us here today, so we're just getting used to it. Okay, everyone, I'm back. I was just doing a little test run there, learning a few things here as we go. So I saw a few questions come through. Some medication is difficult to spell, says Kath. No problem, Kath. It's not a spelling check. So incorrect spelling is fine in Part A. Charlotte says, is it easier than the old one? Well, I believe when you get used to it, I don't know if easier is the right word, but better, definitely. But you need to get used to it like any new exam. Solel says sometimes it's very fast. Yes, well, actually not. It appears fast, yes, and that's the way people speak. So then if it does appear fast, it's about you doing enough practice to deal with that speed. So a lot of listening practice you can do. You know, listen to medical podcasts, listen to communication between health professional and patients, depending on where you're living, watching a lot of TV, and just improving your general listening and note-taking skills will help you in that area. One person, I can't make out the name, mentioned singular or plural. Well, usually it won't have an impact, I think, on the answer choice, but it is case by case. There may be some circumstances where if the answer was plural and you use singular, it's possible you don't get a mark. Gassan says, Solul says, are we allowed to write in all caps? Yes, you can. But I wouldn't advise it necessarily for the writing test, but just use your natural style for writing is my advice. Gassan says, checking keywords and anticipating 12 words within 20 seconds. Well, it's 30 seconds, Gassan, and basically, yes, about 30 seconds to skim through. So it's not a lot of time, but that is the time you're given. And I think, generally speaking, looking at words either side of the gap, engaging your mind, is generally enough time because you don't have to think deeply. And someone said listening part C tips, which I've just given before, so I think we're good there. Grammar, like missing articles, that'll be fine for part A. You're talking about part A there. That's fine for missing articles. It's not testing your grammar at all. And capitals, yep, I think I've answered that one for Barbie. So all good, everyone? All good? Let's go on to reading. Okay, now I'm on the reading page there, everyone. Can you see that? I know it's a little bit small on your screen, but hopefully that's enough to work off. And I'll explain how it works. Now reading, so you're going to do listening, it's about 40 minutes long, and then you'll be in the same room, probably for the listening finishes, then you go into the reading, and they'll hand out the reading papers. Now reading has two parts. Reading part A, it's a speed reading test. Now and you've got 15 minutes to answer 20 questions. Just like the listening, it's graded. So it starts easier and becomes harder. So you want to get a good score for reading part A. I think if you can target 15 or above, then you know you're doing very well. Now there's 3 types of questions in part A. The first 7 questions are matching questions. So I've got a good strategy for the matching questions. And I'll show you briefly here. I've got a book here. I know my screen is small, but you can see you'll have a text that looks something like that. There'll be a text. There'll be 4 of them. The new strategy that we're asking everyone to do, look at text A. Don't just skim it. Now, can everyone hear me loud and clear, by the way? Can everyone hear me? Someone said there's no audio, but I've got my audio on. Just double checking. Can you all put a yes if you can hear me? Just type in, yes, I can hear. All right, that's been fixed. That's just probably a internet issue there, but it looks like it's been fixed. So yes, an interesting strategy for part A, you actually look at your text, right, whatever that may be, read it, not every word, but read it in quite a bit of detail, not simply a skim. Understand it. Then go to your first question on 1 to 7. Go to your first question. It will look like this, everyone. There are 7 questions where you got to match. And look through those questions 1 to 7 and decide which summary or which answer choice matches that question. And there might be 2. Then go to text 2 and do the same procedure. And then the same for 3 and 4. It should take you 5 minutes, guys. Practice this at home before your exam. Allow 5 minutes. And answer those questions. And as you're going, you've had your pen in your hand and you've been underlining keywords. What you're doing is setting yourself up for the remaining questions. So this is not a simple skim. In the beginning, you're doing a bit more of a scan, a bit more detailed reading to answer the matching questions. Then when you go to questions 7 to 13 and 14 to 20, for example, some are gap fill and some are just questions that you have to answer, you should then have a pretty good idea where things are located. You should remember things and you start your skimming, searching. And what you do is you find a keyword in the question, right? I'm reading an example here. If a patient has been touching something or earth, they are more susceptible to tetanus. So I think a word like touching and earth would be key search words, and you search for those words, skimming, and then find your answer. You need to be a good skimmer because it is a time pressure test. And then just follow that through for the remaining, every question answered the same way. If the question's hard, taking you too long, don't get bogged down, just move on. There'll always be a couple of questions that are hard to find, but most of them should not be too difficult to answer. Correct spelling is important in reading part A. All right, so that's it. You've got 15 minutes. Target 15 or above is a good setup for the rest of the exam. Now, then we move on to part B and part C. And look, in this exam we've got now, it's multiple choice questions, everyone. Multiple choice questions. And, you know, for multiple choice questions in reading, same as with listening, you really need a good strategy. You have to understand the nature of multiple choice questions and what it is actually asking you. I think a lot of people have difficulty with multiple choice questions, and a major part of that will be not really understanding the questions in enough depth. That's very important. So I've got some good tips, and I really want you to practice these and go into these a bit more deeply. So part B, there's 6 questions and there's 3 multiple choice answers. And part C, which is a long essay on a health topic, there are 8 questions per text. So, and there are 4 answer choices each. That's a total of 22 questions in part B and C. And you've got 1 hour, so 15 minutes for part A and then 45 minutes for part B and C. And you self-manage that time. I think you allow about 10 minutes to answer your question, your part B, so about 90 seconds for those 6 questions in part B. You want to allow about 35 minutes for part C, which is about 2.5 minutes per question. Now, what do you do? But this is very important. Number 1, you read your question. And when you read it, you underline, and you may make notes. You might ask, why do I do that? Well, you really got to activate your mind here. If you're not thinking and understanding the focus of the question, it will be hard to answer. So really this activation of your brain, thinking about what the question is very important. Then you've got to engage your mind as well. Not only active, then it's got to be engaged. And you do that by circling the subject of the question and certain keywords in the answer choices. Once you've done that, it's possible you can start to predict some answers. You might have some ideas to anticipate whether an answer is right or wrong. You never know till you read the text, but you should be thinking along those lines. Then you read the text. In this new exam, you shouldn't be doing what's called word spotting. In other words, find a word in the question, find the word in the text. You shouldn't use that strategy. That's old school. For the old test, it was a good strategy. The new test is different. Word spotting doesn't work because the words in the multiple choice answer choices are often different because the answer choices tend to summarize a main idea or an opinion of the author. So you've got to look, and it's going to be in different language. So don't word search. You should read, for most questions, you have to read the whole paragraph. That's a new thing. The tasks are well designed to test your understanding. So the best strategy, understand. Remember that test writers may use sophisticated vocabulary in the answer choices, not only the text. So when you see this, try to rephrase it in your own words. Try to rephrase it so that you understand. You won't have that much time for that in listening, but in reading you will. Number 7, avoid answers that seem to be too simple. A lot of people I notice when I'm helping students prepare, they go for answers that just, it's quite direct. It's easy for them to understand. But often those really easy looking ones are quite simple. This text, look at point number 8, you must look for answers that tend to summarize an idea or concept. So you're looking for that more sophisticated type of language. You must think deeply. Answers which are superficial or on the surface are often wrong. And also remember this anticipation part, you are health professionals, you're doing a test for health professionals. Sometimes by logic, you won't always be able to choose the right answer, but you'll be able to rule out certain answers because they'll appear to be illogical. But you can only do that if you are engaging with the question. That's crucial. All right, that's part B, everyone. That's reading, part B and C, MCQs. Part C will definitely be the hardest part of the exam. So hopefully if you're done enough practice and you develop those skills, you'll be able to do well. All right, any questions for reading? If it's all good, just type in all good. Looks like all good for a lot of people. Wonderful. All right. How do those tips sound, everyone? Is that useful? Do you think you can apply that? Do you think you can use that on exam day? Because that's what you need to do. All right. Renelle writes, any tips for part C? Well, that's what I've just given. So MCQs, part B and part C, everyone, it's pretty much the same because it's multiple choice questions. So the strategies are very much the same. There's another question someone's asking, which is harder, C1 or C2? Well, we don't really know, everyone, whether it's C1 or C2. They're just two different topics. it could be C1 is hard for some people and C2 is harder for other people, depending on your how familiar you are with each topic. So it varies, but they should be the same degree of difficulty. Okay, so that's reading, everyone. Now you'll be a bit tired. You've done 2 tests back to back, and the next thing you have to do on exam day is the writing. All right, so could well be in the same room at your test venue. In some cases, they may make you go to a new room. And I'll just redress. Someone said, as you said, it's getting harder. Yes, I can't read your name in the comment. Can you type your name, the person who asked that question? Because it's not reading very well. So I can address you by your name. But remember, for part B, it gets hardest. Reading gets harder. Part A is the easiest. Part B a little bit harder. And part C a bit harder still. Now, it's possible maybe one is slightly harder than the other. It's a good point. It's possible. Or they could just be a perception. But basically, we do mean B is harder than A and C is harder than B. Okay, so this person's name is Black Eyes. Okay, Black Eyes in Russian. Good name. All right. Because I'm getting a Russian alphabet there. That's why I can't read it. Thank you, Black Eyes. Okay, let's go to writing. Is anybody worried about writing? Writing's a hard part of any language exam. Maybe the first question is, how do you get a B grade? Well, 1, read the task question carefully. Knowing what you have to do. And there's a few things like you need to know. The task question says do not use note form. So number 1, follow the question. Some people use note form and of course they'll lose marks because it says don't use note form. It says expand on the relevant case notes into complete sentences. Yes, do that. Expand into full sentences. That's a basic requirement. It's not a handover note. It's not a handover. It's a referral letter. The body of the letter should be approximately 180 to 200 words. You could probably, that means the body, not the address and not the closer and probably not the conclusion either. But the introduction and your main paragraphs, that's where they're looking at around 180 to 200 words. But we do use the word approximately. So apply the 10 or 15% rule. A little bit over, not a problem. A little bit under, I'd be careful with, but a little bit over is fine. I think one thing I noticed that an error that a lot of people make with writing is they don't read the case notes carefully enough. Again, it's like any other part, look at your patient's histories. There is always a little bit of complexity when you read the case note. So you should be actively searching for some complex nature. There'll be something complex in the patient's history because let's face it, if you are referring on the patient, if another health professional is going to be involved in the care, then there must be a reason for that. There must be something there that, in the patient's progress that's not quite standard perhaps, or that requires that extra support. Now, Shala's written, in my exam, it's discharge letter. What's your profession, Shala? What's your profession? Discharge is very common, but even I'm considering a discharge is a type of referral as well. Now going through, we've got a bit of a tick cross method. So one thing you can do on exam day, you'll have your pen. There's 5 minutes reading time where you can't use your pen, but after that, you start reading through and checking each of your answer choices, reading through, checking what's important and what's not important, what information can you include, what can you leave out based on who you're writing to. A couple of other good strategies. One thing people forget, check each letter for, because you may have made a a common error. In other words, check each sentence, and probably at the end of a paragraph. At the end of a paragraph, I would go back over, so not every sentence because you break the flow of your thought process, but at the end of each paragraph, double check, because perhaps what you wrote didn't match what you were thinking. So always remember, double check your sentences for the little errors. Don't forget to check that your articles, prepositions, and your be verbs are used correctly. Don't just copy from the case notes. You've got to create full sentences. A good strategy, if it's a long time ago in the past, it's going to be summarized. Put your attention to the most recent condition. That's where your focus should be. And make sure your letter is well organized with a clear focus. So that's your planning stage. Clear focus on the main issue or chief complaint. And we've got a little bit of extra information here. For most tasks, the introduction should clearly identify either the chief complaint or diagnosis or procedure. So right at the beginning, you should state really clearly in summary form what that patient's main issue is. Not just the purpose you're writing to refer this, 83-year-old woman for ongoing care. That's pretty, it doesn't really tell the reader much. You need to state their condition or procedure right at the beginning is my advice. A couple of questions coming through. Hen says, if I miss some relevant information because the letter is too long and full of details, will this decrease my mark significantly? Yes, if you miss a key component, it's going to impact on your score definitely, because one of the categories that you're rated on is your ability to, it's called comprehension of stimulus. So you need to understand. That's why you plan carefully and read it carefully. But if it's not major and everything is good, then yes, you can leave out perhaps a certain detail, because think about it like this. If 10 doctors write a referral letter, they're all going to pick slightly different things. So it's not so much everything is a must, but the better you do it and the more you accurately identify the key points, then the better your writing score will be. I'll give you a little example of summarizing and paraphrasing. So you might see in the case note, smokes 20 cig a day, 10 years, alcohol use 3 standard drinks at night. Now when you write your letter, you're better to summarize that than to simply paraphrase and write, patient is a heavy smoker and drinks on a daily basis. That's a much more effective way of writing. And the next example here, patient admitted to the accident and emergency department on a certain date after falling down some steps while shopping at Coles. No loss of consciousness, did not hit head, felt dizzy after fall. So we've got all those facts. So you've got to add the grammar, everyone. Patient was admitted to our accident and emergency department following a fall on this date. There was no loss of consciousness, but she experienced dizziness. So that's the trick. You've got to be able to expand effectively and have that grammatical awareness to allow you to do that. I'll give you one more example. Here's a set of case notes of a patient. And if you had to summarize this, perhaps you've written your introduction already. You put a summary of past history, perhaps. But then you want to talk about progression, everyone. That's a very important part. How has the patient progressed? And we've got some information here. We've got a patient's name, Ian Hale. You get it? Inhale, exhale. It's a bit of a funny name for this patient. We've got an admission date. We've got a discharge date. So always pay attention to dates. Make sure you're aware of that. And what we have here, when we look at it, we can see it was a fracture, neck of femur due to fall. Now, let me ask the audience a question. If someone's had a fracture of the femur and a THR, total hip replacement, what's their main issue going to be? What's their main issue going to be? Are they going to have, I'll wait for people to answer. What would a patient's main issue be if they had a fractured neck of femur and underwent total hip replacement? Now, while I'm waiting for those answers, I'm going to read some comments. Charlotte says, grammar makes me stressed and I forget what the letter is about. Passed OET by miracle. Yeah, oh, I remember you, Charlotte. Great to see you there again. And again, you passed everything with writing. Well, come back and join us, Charlotte. We've done a lot of updates to our courses so we can help you yet again. And Mariah says, if a patient is depressed after his ongoing disease, he needs psychiatric assessment. Do we need to mention these to our doctor as well in our referral letter? I think so. Absolutely, if they're depressed. And any time you're bringing in another health professional, right, you should always involve, if there are allied health professionals involved in the care, you should mention that to the person you're writing to because it's part of a team, the team approach. And each member of the team should know what other people are doing. Now, Samira's has answered that question, mobility. Now, that's a good point. Look at this case again. It's an 80-year-old man and he's had a hip replacement. I think straight away you know why he needs to be referred because he's elderly, he's had a major surgery, he'll have difficulty with mobility. So your focus should be on mobility. Now, remember that. If it's someone with COPD, then you're going to talk about the breathing function. If it's an obstetrics type case, perhaps you're going to focus on the developmental guidelines of the baby, right? Things like that. And if it is a psychiatric case, then you're going to look at past history, medical history related to that condition, family history, and also their progress and examples of their mental state. So you should be able to categorize based on the condition. This one, pretty basic, fracture of hip, so obviously mobility issues. And then we can see an initial date difficult to mobilize. We've got all these facts. On the 19th, he could walk 5 meters. On the 20th, he could transfer from the chair with an elbow support frame. On the 30th, so that's about 2 weeks later, he could actually walk 15 meters. That's progress. Then prior to discharge, he's doing quite well, only needs minimal assistance, and he's now mobilizing with a 4-wheel walker with one assistant. So that's progress, everyone. So when you write your letter, don't focus on the detail. In other words, let's think about a forest. Don't focus on the trees. Trees are just the facts. Talk about the forest. In other words, the overall condition. And in this case, we can see here the summary. In terms of his post-operative condition, Mr. Howell found it difficult to mobilize at first due to left hip pain. However, during hospitalization, he's made steady progress. He is now able to walk with a 4-wheeled walker with one assistant. He only requires minimal assistance with showers and is able to dress himself with prompting. So that's a really nice summary paragraph. Mr. Howell is due to discharge on the 11th of April 2018 and his daughter and son will escort him home. Now when you read that, I want you to pay special attention to the verb tenses. Started off with past tense and described his initial condition. After past tense, moved on to present perfect, right? Because we're talking about progress from the past up to now. Then we've talked about now, that's present tense. So that's the following sentences talk about his current condition. And then after discharge, there's some future plans, so we've moved to future tense. So that's a really nice pattern for you to remember. Be careful with verb tense. and be careful with your time references. And if you can write like that, it will be clear and organized. So practice that between now and your exam. All right. Any questions about writing? If it's all good, just type in all good. While I'm waiting for your comments, I'll go to the next one. Mariah says, how many times we can mention patient's name in every paragraph, Mrs. Jackson or the patient? Well, great question, Mariah. A good answer for that is, I would suggest at the start of each paragraph, use the patient's name. At the start of each paragraph. Then following that, you can use he or she. And that should work. If you change topics, if you suddenly started talking about the patient's daughter and then you went back to the patient, well then that's when you might use the word patient, or you might say again, Mrs. Smith or whatever the patient's name is. Sumya says, if the writing has many corrections, will it affect my grade? Absolutely. Like, simple question, how do you get a B grade? Most of your sentences need to be accurate. Simple as that. If you're making multiple errors, it's going to impact on your score. B level is quite high. Sumar was writing a sentence. He had been a heavy smoker before he quit 5 years ago. Looks like a good sentence, Sumaira. Looks good to me. Okay, any more questions? I think we'll now go to speaking. Charlotte's coming with one. If I write a very short letter, will it affect my mark? Absolutely. If you're writing 160 words, it's not enough. You've got to write 180 to 200. My basic advice is try not to go under. A bit over is okay. Bit under, not enough, data. You're an excellent summarizer, but I think most of the time that would indicate you've missed some information. Kassan says, how many grammar mistakes will be accepted? Well, I could ask you, how long is a piece of string? You don't know. Every piece of string is different. So when you ask how many grammar errors will be accepted, it depends. Some grammar errors are significant, some are minor. So just case by case. But as I said earlier, you should be able to write with, at a B level, you should be able to write with control and accuracy and do a variety of things. Simple sentences, compound sentences, complex sentences. All of these things should be in place. Okay, let's now move on to speaking. Speaking is the last part that you'll do on exam day. And you get a bit of a break. This is your chance for a bit of a refreshment. And then your speaking will be scheduled at a certain time of the day. And you're going to do 2 role play tasks. Now, speaking 2.0, again, it's a bit different than before. And they've changed the focus a little bit. The role play cards are the same, but what they're interested in a bit more than before is whether you can achieve a successful outcome for your patient. In other words, if a patient comes to you with a problem, can you identify what that problem is? Can you provide reassurance? Can you give advice, relevant advice? Can you ask follow-up questions to gather more information of the nature of their condition? If you do all those things, and then by the end of the role play you've given good advice and you've solved or addressed that patient's issue, that's a very good thing, everyone. Even though you may have made some grammatical errors or some pronunciation errors, or maybe your fluency's been down a bit, those things are all fine if you're demonstrating active listening and appropriate responses. So it shouldn't be pre-planned. It should be about you engaging with your patient and making it real. Remember, it's a role play. So you've got to act out. You've got to be able to act out your role. So you've got to be a good actor, everyone. Good volume is important because it's recorded. Your job is to provide structure because you're leading the role play. No monologues, create interaction as you go. It should be very interactive. If you can do all those things, then you're on your way to a good score. They do give you 3 minutes to prepare, and during that 3 minutes, you should underline all the key words. And in this example I'm showing you here, it's got 2 parts. It's got the scenario, and this patient has a UTI, and it's got the task. Now, the task is just to guide you, right? It's useful. It tells you what you need to do, but it's common sense. So what's really important is the scenario. In this case, 42-year-old, she's come to see you because of abdominal pain. We can see the word UTI. So you should know straight away on exam day, okay, I have to take a history about a urinary tract infection. So you should be ready, and what you do in your 3 minutes is pre-plan your questions so that when the role play starts, you don't just rush through it really quickly. This first task question, ask patient about presenting symptoms, that's probably at least a minute or minute and a half of your role play. You should ask multiple questions to create that interaction and make it real. While you're doing that, you can address the patient's concerns. You can see down the bottom she has some concerns. She thinks there's blood in urine, could be cancer. Obviously, that means there's going to be an opportunity there for you to reassure the patient that that isn't the case. So that's an example of a patient's concern. And when you do those things and reassure, do this strategy here, 3-sentence responses, everyone. Empathize, show sympathy and understanding for whatever their concern is. Then explain what you can do to help with that problem. And then justify it. State why you've done that. So that's 3-sentence responses. You should, when the patient asks you a question, you should reply with 3 sentences. That means you're expanding. All right, so that's speaking, everyone. Any questions about speaking? Mary's asked a question. If she is reluctant until the end to follow my advice, how can I finish the role? Okay, well, that's a good question. If for whatever reason the patient chose not to follow your advice, then you can stay strong and simply say, now, you've decided not to follow these instructions, but I have to tell you that's at your own risk. And in my professional opinion, you really should take your medications regularly, or you really should not discharge, or whatever it is. You never weaken. Stick to your line. Mariah says, how to deal with a reluctant patient when she does not accept your advice and denies her blood test and result. Yeah, same thing as Mary. You just have to stay strong and just say, but that's your opinion. And to be honest, most cases, it will say for the patient, initially be reluctant, but the patient role play will say something like, finally accept health professionals' advice. So eventually they're going to listen. Your job is to give real examples and to say why they need to follow, and use things like consequences. If you don't follow my advice, if you don't take your medication on time, there could be serious complications. And in some cases it can lead to, whether it's death or more severe condition or heart attack. You just state the facts. That's what you do. Black Eyes is saying, I'm facing difficulty only in reading and repeating exams second time. So my question is, if I get a course with you, that will help me in Part A. As far as I know, it's only a skill for Part A. Well, good question there, Black Eyes. We've got excellent reading courses and we're getting really, really good results. So I would look on our website at virtual classes for reading in particular. We definitely do a lot of work on Part A reading because remember there's 42 questions in reading So if there's 42 questions in reading, 20 of them are part A, it's half the exam basically. You need to do well in part A. But there are ways to do that. But also, we would always aim at making you better in part B and C as well. Okay. Now, a couple more things. So that's basically, I'm going to say good luck to everybody. And it's your chance to ask any questions that you have now about any part of the exam or about the courses that we offer. But on Sunday, the exam is on Sunday, everyone. So I really wish everyone good luck. You've still got a day, 2 days to prepare. So really get stuck in if your exam is on December 2. And I'll just show you quickly 2 more things I'll show you. So just if anyone, how many people haven't studied with OET? I might ask you, how many people, 2 questions. 1, if you're a current student, just put current student. I know some people are. And if you have not studied with us, just put not studied with you. Just type that in. I'm interested to know. And another question, how did you hear about this Facebook Live? Because this is our first Facebook Live session on our Facebook page. So how did you hear about it? I know many people like Barvik are current students. Maybe your friend told you, were you just browsing to Facebook? How did you hear about us? And if you're a current student, are you enjoying your course? Has it been helpful for you? So a few people not studied and a few people have. That's good. So look, if you're new and you're going for January exam, Charlotte's going to come back, study before, going to rejoin when you're ready. You do that, Charlotte. I'll be looking forward to helping you. We run classes every month. So the next exam after December is January 12. So we're going to run some classes from December 3 to December 14, so starting next Monday. Then we'll take a break, but there'll still be online review available. And then we come back early in January. Class time is 6 p.m. to 8 p.m. That's Brisbane time, UTC plus 10. That'll be in the morning in Europe and in the evening in Australia. Rama says, is this exam recorded? Yes, you'll be able to watch this later on when it's ready. And the very last thing to show everyone, I'll just bring up a new page. So if you are new to us, there's our website, everyone. If you've got the exam coming up very soon on December 2, we do have some mock tests available there, especially the new ones for reading and listening. I know what someone was asking, Black Eyes was asking about reading courses. So we've got great reading courses here that will really help you. So check out the website for full details. And I just thought you might have seen it on our Facebook page. A lot of our students that took the exam in November got very successful results. So a lot of good testimonials there. You can even see one from Dr. Hamza, who's very happy and celebrating his success. And the material we've developed, it's all our own material, everyone, and it's all of exam quality. So if you do study with us, we'll look after you and help you get a successful result. So check out the website, oetonline.net.au, and we look forward to helping you. Now, final questions to answer. Yes, Chai says online mock test. That's right. We've got online mock test. So it is possible to enroll in that, particularly for reading and listening now. The writing and speaking is passed because Today's Friday, but you do have an opportunity to do reading and listening. Check the website out. Hen says, if there are too many numbers in writing, for example, thyroid function test, can it be summarized by saying thyroid profile indicating hypothyroidism? I think that would be excellent, Hen. I think that's what they're looking for. Save you a lot of words and very clear. Kath says, I was enrolled in reading class. Can I get answer key for reading exercise during the class? Yes, those will be posted there on your course page, Kath. And if you have any further questions about not being able to get some information, send an email, everyone. If you've got questions, you can just send an email to, best place to get a response will be, I'll type it in as well, info@oetonline.net.au. That's for email. And we also have on our page, if you do want to get in contact with us about what we offer, we have a contact us page here. So we have an email address and a phone number. And definitely on Facebook, guys, use Facebook Messenger. Just send a comment on Facebook Messenger. Nice idea, Black Eyes. Happy to respond that way as well. So you can use Facebook. Final questions coming through. How many mistakes in reading and listening leads to B grade? Well, it's out of 42 marks, listening and reading. You need above 30, everyone, is what people are saying. Above 30 to get a B grade. A question there from Charlotte. Is it all right to join writing only? Absolutely. Just select what you need. So you can do all skills if that's what you need, or single skills. All right. Well, I think I'm going to wrap it up, everyone. I wish everyone who's taking an exam on this coming, let me just go back to the screen. Here I am. You can see me on the big screen, everyone. So, yeah, everyone taking the exam on December 2 on Sunday, fingers crossed. You like the exam and it goes well. We got people really like the November exam and excellent results for a lot of our students. So I think it's going to be a very stable exam, and look forward to helping you. Oh, and Tyab says I need some material related to radiography. A very important point about OET Online. We've been doing this longer than anyone. So we've been going for more than 10 years with an online presence, and we've got material for every single profession tested by the OET Centre. Most schools don't do that. They just cover doctors or nurses, you know, but they're not really dedicated enough to make material for all professions. But at OET Online, that's what we do. So excellent material for radiographers, also for all professions tested by the OET Centre. So it can help you with that. All right. Thanks, everyone. Have a wonderful exam. Any further questions, get in touch. We're here to help you if you need us. Bye for now.